Hello. Hello, Jocelyn. Back for more. Karen Wrigley, I see you there. Hello. Andrea, hi. Nice to see you. Looks like it's nighttime where you are. What part of the world are you in?
I'm in Vermont.
In Vermont. Not
Mhm.
nighttime there though. You're just in a darker room or?
It's been cloudy. We've been getting a lot of rain.
Very good. Yeah.
Yeah.
Are you in that pathway from the hurricane?
I believe we are. We've been having some pretty heavy flooding, but I'm okay right now. But
Very
yeah,
good.
just been kind of thunderstorming the last few days.
Right. Yeah. Different in all parts of the world. It's hot where I am. Hot,
Yeah.
hot, hot. Yeah, amazing. Anne, I see you there. Hello.
Hi.
Hi. Back for more. Hooray.
Yeah.
Rachel Williams, I see you there. Busy at work, doing something. Letitia, hello. Julianne, hello. Jenny, good day. Raquel, hello. Love seeing familiar faces. So fun. So today we're on day three. Day three. This has been such an interesting 3 days. I absolutely love reading the shares from people, the insights you're getting as you're going through this course. It's really interesting. And today we are getting into the hands-on care. Hello, Jamie. I see you there. Hi. Kelsey, hello. Those of you who are here, but you don't have your cameras on, if you are comfortable turning your camera on, that would be terrific because then we can see you. And when you're working with sensitive areas, talking about sensitive subjects, it's great if people have their camera on because it does create an atmosphere of safety and trust when we can all see each other. So while we're just getting going here, I want to know, does anybody have any shares from yesterday or the day before that they want to put into the circle? I love having social learning, us being able to bond as a group, and we're going to have time at the end of today for some community shares. We're going to have a share circle so we can hear about each other's experience and share our own. It's really important when you're doing, I think, mindful breath work, having that sort of heart-centered approach is really important. If you think about where the breasts are, just go ahead and do this. If you have breasts, if you have chest, whatever you have there, put your hands on either side, just on the slope of your chest, and then have your fingers pointing towards the middle. What are your fingers pointing towards? What major organ is there? The heart. So the breast and the chest are on either side of the heart. So if you're going to be doing this work, it is heart-centered work, and it's physiological and it's also emotional and psychological. The heart center is very involved with breast and chest work, and it's how I like to run the mastectomy guide. So I really love having space for people to put their voice into the circle and let us get to know you. So if any of you want to put your voice into the circle, this is a good time. The intimidation factor is real. Safe space. All right. Well, you can think about it for later since we are doing our share circle. So I'll just say hi to Patty there. I see you. Hello. And Leanne, hello. Beth, so nice to see you. And C. Armstrong, I'm not sure what your first name is, but super glad that you're here. Thank you for turning your camera on. And Nguyen, also thank you. Hello, nice to see you.
Russia's trying to figure out that they went to China.
We've got someone who needs to mute here. All right. Well, I am in the South Okanagan. This is the Syilx people's traditional unceded territory. I'm so grateful to be able to live and work and play here. And I really love setting the intention for a positive, co-creative future where everybody gets what they need so that we can all survive together, and not only survive, but thrive. So that's all the people, no matter what their cultural background is, all the plants, all the animals, the trees, the water, everybody gets what they need so that we can all thrive together. I do believe humanity will sort it out and that we will be on the right side of the line in a short period of time, hopefully a short period of time. That's what I'm voting for. So Raquel in the chat here says, well, the history of surgery was horrifying. I understand that. But reaffirm the need to learn about the process of what these patients go through to better be there for someone. Yeah, I so agree. And the thing about these surgeries, partially because it's been women's health, and partially because it's been a part of the body that has been, pretty much taboo to talk about, it's really been swept underneath the carpet for most of the time. It's really only now that it's actually becoming a conversation piece. And there's really little to no rehab at the moment. It's a big gap. It's a big void. So for people who want to learn about it, there is opportunity now, which is great. And I discovered the void is not only there for the patients, the void is there for the therapists. Until I started creating these courses, there really wasn't anything out there to teach you about all the surgeries. And I know now there's a couple of things that are out there, but there's nothing that's to this depth. And I really believe the more that you know, the more you are capable of helping your patients, the more you're capable of offering good clinical reasoning, that you can work your way through the different stages of healing. When you're working with people who have gone through traumatic situations, whether it's now or in the past, and you can make adaptations to offer true trauma-centered care, trauma-informed care, then it really makes a huge difference to the quality of your care as a therapist. Plus, it's fascinating. It's some of the most interesting work I've ever come across. And I've dabbled in a lot of different things as a massage therapist, because in my first few years, I was trying to find my way. So I tried a lot of different things. And this work, it just doesn't stop being fascinating, because what people go through is incredible. Even to this day, they're not the mutilation surgeries anymore. And that's a real term, by the way. That's not my terminology. That's in the research. When they're looking back at the surgeries that people used to go through, that's the terminology that they use, the mutilation surgeries, because it was just incredible how much of the body they cut away. And now they're a lot more humane, but it still is extensive. So it's really fascinating, because we're on the crest of new information, which is coming out there all the time. It's very progressive work. So when you're on the front end of the wave, it's always new. There's always things that you're learning. And it's got that excitement of oh, this hasn't been done before, which is really cool. Secondly, the people are amazing. The people are so authentic and genuine when they show up. A lot of times the barriers that people normally have are just not there, because they've kind of been cracked wide open by this major life circumstance that they're going through. And so they show up in a way that a regular client doesn't show up. They'll share things. They'll be going through their own process. And I think it's an incredible privilege to be able to see somebody up close and personal as they're going through this major life transformation. And women are just the worst for putting themselves first. So many women are like, oh, later, I'll take care of myself later. I'll take care of this person first. I'll take care of my house first. I'll take care of my job, my family, everybody else, and I'll get to myself at some point, because women are strong creatures. We can just keep going. But it doesn't mean we don't suffer when we don't take care of ourselves. One of the things that I love is watching people wake up to the fact that, oh, I matter in my own life. I actually need to put my well-being into my day as important. I can't keep putting myself last. I need to make sure that I am present for myself. I'm actually making time in my day where this is for me. And for a lot of them, it's a new skill. They haven't done it before. They spent most of their time putting other people first. So when you're able to watch somebody go through a major life transformation like that. You're able to put your hands on a part of their body that normally they would never allow anyone to work on, partially because it's a sensitive and private part of the body. And also, it's surgicalized, it's been altered. And so they're like, I don't want anyone in my vulnerable place, but you get to put your hands on there. You get to be in their life while they're going through this major experience. And that is such a huge privilege. So I think it's spiritual work. I think it's divinely ordained that this work come to be. As I told you before, I'm a mystic at heart, and I feel like my invisible helpers were like, Erin, there's a lot of the world that's suffering right now. There's a lot of pain out there in the world that doesn't need to be there. You have to help bring awareness to this situation and help move the needle forward. And I was like, I hear you. I got it. I got the memo. I hear you. So I started putting myself forward to do this work. And now our paths are intersecting because you're also hearing the call, which I love. And I would be so grateful if you would decide to take it up and make this a part of your practice where you do want to move forward and you do want to serve this clientele. And I'm here to help make that process easier because I had to learn by trial and error, but you don't have to learn by trial and error because now there's courses out there that can actually teach you what to do. And there's people that you can ask questions to. There's security that you can get from being in a group. And so I want to help facilitate that process for you. Yeah, in the chat here, Jocelyn says, another reason we burn out at work, we put others first too much. It's so true, where we're like, oh, I can do one more. Oh, okay, I'll come in on my day off. Oh, okay, I'll just add on another treatment at the end of my day. I'm really tired, but I can do it. Women are strong creatures. And often our strength is overlooked because it's not always a flashy strength. It's sometimes a quieter strength, but it's the strength to keep going, which is in the end the strongest thing of all, because that's how you are able to stand back up after life circumstances. Maybe you're feeling like too much, but you can just keep on going. And I want to celebrate women for being able to do that because, you know, the world needs us. The world, we cannot sit around and wait for other people to fix the state of the world. It's just not available. We have to be the people that we're waiting for. And I believe all of us here are able to do that work. So I'm thrilled. Hooray. Okay, so let's just remind you of the prizes that we've got here because they're pretty fun. So for people who are showing up live, who are doing all the share activities and like and comment on other people's posts, they become eligible for these prizes. So the first prize is a 1-hour coaching session with me, which is a $250 value. So if you feel like I got questions, I want to, I've got a patient that I'm working with and I want to talk through what the scenario is or whatever you want to cover. I will put a caveat on this though. One person who won this before, they were like, oh, so then can you sign off on my insurance forms that I've been trained in breast and chest massage and now I can go out into my practice after this 1-hour session? I was like, no, I can't sign off on that. That's not what this session is for. So I won't be signing off on your insurance. However, I am here to help you with any questions that you might have, any direction that you want to go. I can help with this. So it's one-on-one time with me. The second prize, if you decide you want to be a part of the Academy, then once the Academy is finished, you get 6 months of the MG Treatment Library, which is a video textbook to teach you all the different skills on how to work with this population. And the third prize is these breast surgery cue cards, which is a $50 value. And that gives everything in terms of the content in our level 1 course and integrative cancer care course, but in a very abbreviated fashion. So you learn about the different surgeries and components about breast cancer so you can be informed. It's a really cute little book. So those are our prizes, which we'll be announcing by the weekend. Today, what we're going to cover is the science of mindfulness. Now, I know yesterday the theme was all about science, but I'm not going to drop it because it's so much a part of what we do at the Mastectomy Guide. So I do want to show you some information that science has about mindfulness. But today's very practical. This is a practical day. The last two were a lot around theory. Today's around practical. So we're going to start you out with a very easy and very effective mindful breathwork practice to help you bring, into the present moment, feeling yourself centered. You can pass it on to your patients as well. Really good light touch technique for chest and shoulder tension. You're going to get hands-on practice with your own self breast massage. And when you're doing that, you're going to want to be in a place where you are in a private location. So nobody's going to walk in on you unannounced, because you're going to be disrobed if you're comfortable to do that, and actually working on your own body following a video in our treatment library. Then we're going to have time for a share circle so we can bond with each other. I do believe in social learning and community connection, so we're going to create space for that. And then next steps for more education, because there's going to be some of you who are like, oh, I feel the call, I want to go farther, and I want to make sure that you have what you need so that you can go farther. Now we're just going to go into the Mentorship and Training Academy just quickly here before we dive into our day 3 material. I covered this a little bit yesterday, and this is all centered around breast, chest, and oncology massage. It is a 200-hour program, takes place over 6 months, and it starts in September. It's all virtual, so no matter where you live, you can participate, and it's the gold standard for doing this work. It does really have 3 pillars that it stands upon for your learning and growth. It's got our core curriculum, which is 4 really quality courses. It's got a supportive community of really awesome people to help you learn and grow. And also we help you with the marketing and communication so that you can get the word out to the people around you and let them know that you're doing this work, and you can bring them into your practice, as well as create referral relationships with doctors and nurses and chiropractors, physios, wig shops, cancer groups, pride centers, like all of the above. So we want you to be well-resourced in your local community, because the goal for the Mastectomy Guide is that we get a trained therapist in every town across North America, because people get these surgeries all over the world, and we want there to be trained professionals no matter where you live. So that's why the course is virtual, so you can join from anywhere. It is accredited. The backbone of the course, 3 of the 4 are in this comprehensive breast and chest surgery training. So across the US and across Canada, it is accredited, and it's recognized as being quality material. And if you feel like you want to explore more, just take a moment, grab your mobile device. If you haven't done this yet, just scan a QR code. It's going to take you right to my booking site, so you can get your own one-on-one time with me, so we can talk about your practice, what your goals are, and how our training can fit into your goals. All right. Now, let's get into this mindfulness science here, because we want you to understand there's actually some bite behind this. It's not just woo. Mindfulness-based stress reduction is a 8-week program. It's been studied more than any other type of mindfulness, and I think it's because it's an actual program, so it's replicable. And what it is people go through this process of becoming very mindful, very centered. And what they've seen is that when people are following this program, and especially if they're going through breast cancer, it helps their immune system function more effectively, which is really important. If you're going through a potentially mortal illness, you need your immune system to be functioning. It has a particular effect on natural killer cells, which is really important, because natural killer cells are the first cells on the scene if a cell has become mutated. If it's become cancerous, the natural killer cells are like, alert, alert, there's something going on here. We need to deal with this anomalous cell, and we need to be first on the scene. They're like the first responders. So if your patient is practicing mindfulness, then they're able to help their natural killer cells function more effectively, which is a strong part of their immune system. It also helps with coping strategies. Coping strategies are essential because when people are going through very challenging situations, they have to be able to cope. It's not a sprint, it's a marathon. It is the long game. So people need to be able to work with what their life is presenting them over a long period of time. So coping strategies are very important. Stress management. When people are highly stressed, their reactionary measures go up, their decision-making capacities go down, their inflammatory states go up. It's not a great state. So mindfulness-based stress reduction has been shown to be a very effective tool for stress management. Good for relaxation, which is really important because when your body is relaxed, that's where the healing comes in. It triggers your innate healing capacity from the inside. So these are really, really important components. And you might be thinking, well, that's great if my patient is mindful, but what does this have to do with me being mindful as the therapist? Well, there's very interesting research on brainwave entrainment and heart coherence. I really love this because when we're operating with the biopsychosocial spiritual model, then we're thinking about the bigger picture. We're going beyond just the physical, beyond the emotional, beyond the psychological, the social, and we're thinking about how are we operating in the bigger picture. And this is a great way for us to begin to understand. So what they're finding is that when a person is in a room and there is skin to skin touch going on with a caring and healing intent, that registers in the person who is giving the touch. So for us as massage therapists, we are the giver. That registers in our heart's electromagnetic field. And at the same time, in the receiver, so that's your patient or your client, their brain waves register that increased coherence. So it creates this synchronicity between the brain waves and the heart's electromagnetic field. So it has a reverse effect as well. If we come into a very mindful state inside of ourselves when we're practicing, then we can help our patients when we have our hands on them to become into a more mindful, present state. So we can help influence the state that our patients are in by ourselves being mindful. And I think this research is really amazing. This comes out of the Heart Math Institute, which if any of you who put a yes in the chat, if you are aware of the Heart Math Institute and the work that they do. They're very progressive. They've been around for quite some time now, actually, several decades, and they are doing extremely progressive work on how the body is maneuvering. And they've found that the heart's electromagnetic field is way bigger than the brain's electromagnetic field. It's actually astonishing. And I think that's incredibly important for the work that we're doing now, because if we're showing up in a heart-centered way, then we are allowing that state to register within our patients' bodies as well. For those of you who are not familiar with it, it is the Heart Math Institute. Oops, I'll put that for the people in the waiting room. Heart Math Institute. Hannah says the same thing happens with horses and humans. That makes sense. Yeah. And that's one of the reasons why people can do equine therapy. So it's applicable for people as well. And this is something that you can consciously cultivate with your patients. Now we're going to do an experiential exercise here. Today is all about the practical. We're going to be doing a breath technique called 5-finger breathing. This is something that you can do anywhere. You can do it in your clinic in between patients. You can do it anytime that you are feeling a little bit agitated or recognizing, wow, I'm everywhere. I'm scattered. My brain is here and there and everywhere. And I'm like too many ball juggling in the air and I can't keep track of things. I need to just come down several notches. You can do this technique.
Don't worry, my friend. We're gonna help you out, Jace.
Sorry, who is unmuted here? Hard for me to tell. Oh, I think you took care of that. Okay, groovy. So what you're going to be doing is sitting yourself comfortably on your whatever you're sitting on, your couch, your chair, your bed, whatever you're on. And I want you to note out of 10 your level of kind of tension, stress, disconnect, busy mind. 10 is a lot, 1 is minimal. I want you to take note of where you're at right now. And then we're going to be doing this exercise. I'm going to outline it first, and then you're going to be doing it with me. We're going to do it all together for 3 rounds after. So we're going to use our hand, and this is good to get a connection between our mind and our body. And you're going to be running your finger up one side of your thumb and down the other. And you're just outlining your hand like this. You're tracing the outline of your hand. You're going to go all the way around. But what the breath part is as you're tracing your finger up one side of your finger of the opposite hand, you're breathing in. So this is a breathing in cycle. You crest over the top of the finger, and then you come down the other side, and that's when you breathe out. So you breathe in and out, and then we go all the way around. Okay, so that's the theory. And now we're going to practice it together. Okay, so you can do this for yourself, and you'll be able to give it to your patients as well for home care. Okay, so make yourself nice and comfortable wherever you're sitting, whatever you're sitting on. If you want to close your eyes, you can, or if you want to watch, you can do that too. Put your index finger of one hand at the base of the thumb of your other hand, which is spread open. And then as you slowly run your finger up, you're going to breathe in. Run your finger over the top. Now breathe out as you come down the other side. Stay with me. Don't go ahead. We're on the thumb. Coming down to the base of the index finger. Breathing in. Breathing out. Up the other, the third finger. Breathing in. Over the top. Breathing out, down the other side. Up the fourth finger, breathing in. Over the top, breathing out, down the other side. Breathing in, up the pinky. Breathing out, down the outside of the hand. Going back to our starting place. Breathing in. Breathing out. Really feeling your breath. Breathing in. Concentrating what you're feeling. Breathing out. Being present. Breathing in. Breathing out. Breathing in. Breathing out. Breathing in, up the pinky. Breathing out, down the outside of the hand. One more time, going to the base of the thumb. Breathing in. Breathing out. Starting on the index, breathing in. Breathing out. Up to the third finger, breathing in, breathing out, being present. Breathing in, breathing out. Breathing in, breathing out. Good. Lower your hand. Take a moment to check in with yourself. How do you feel now? If you are going to put a number to your state, how would you feel now? And then pop it in the chat. What number did you start with? And what number are you now after that exercise? Cleared my mind, wake me up, aware of my own pain, good to know. Now a 5, a 3, an 8. Letitia feels tired. Sometimes you become aware of your tiredness or aware of your pain. Started with a 7, ended with a 3, started with a 7 after a 4, from a 4 to a 2, relaxed me, focused, 3. Great. So these are great results in a short period of time. So this is a technique you can use for yourself and that you can use for your patients, cultivating mindfulness, having another tool in your toolbox. Pop a yes in the chat if you love having new tools in your toolbox. I know so many massage therapists are like, I need more tools. Yes, love having new tools. Yeah. All right. Now you're going to be doing the same hand, ideally, that you used for your breath work. And you're going to be doing a light touch technique on your chest. Now, I want all the work that you do today to be on the same side of your body because you are your own experiment. You're your own science experiment. You are your case study today. So I want you to feel the difference when you're doing the work on one side of your body as opposed to the side that hasn't received the work. So you just did an awareness exercise on one hand. So then as we're working on our chest and our shoulder, I want you to keep that same side so that you can feel the difference. All right. Now, our next exercise to begin with, I want you to look at yourself in the camera, sit yourself up so that you can see yourself. And if you go to your tile on the screen, I'm going to unpin myself here so it makes it easier. I want you to hover over your screen if it's easier on your computer, and then click on the 3 dots and a little drop down menu will show itself. And what I want you to do is click pin. So you want to pin yourself on your screen so you can see yourself in large. Okay. So you click pin so you can see yourself large. And then I want you to sit in front of your screen and look at your shoulders. I want you to see the position of your shoulders. If one is higher than the other, if one is curled more forward, if they're sitting evenly, what are they doing? Just take note. And we're going to relook at this again after this exercise. Okay, so then I want you to remove your pin. So go back to your 3 dots and click remove pin. And I'm going to spotlight myself again so that I'm easier for everybody to see as I'm guiding you through this activity. So remove your own pin so you become smaller. And then I'm going to spotlight myself now so that everybody can see me. And what we're going to be doing is we're working with the mechanoreceptors of our pec major muscle. Now, the mechanoreceptors, as we explained yesterday, respond to a light touch, but they do take at least 7 seconds of intervention in a spot before they will respond. So it's very useful to use 4 fingers because we're not moving fast. So we want to cover a little bit more geography with this movement. All right. So you're going to start where your clavicle meets your sternum. And you're going to take all 4 fingers and just do a gentle curve with your fingers. You're not digging in. This is not deep tissue work. This is light tissue work. So roll back on your finger pads a little. And then you're going to be following the contour. So I want you to follow along with me here. So you're going to be doing a little bit of repetitive shear. This is a micro movement. You can see that. You might have to look very close to see what I'm doing. It's a miniature little shearing. I may have enough pressure to create a little bit of blanching in my fingertips, but not a lot. There should be no real pressure, no real pain. You may feel some tenderness on your pec major tendon, but you want to be doing this little micro movement, nice and slow, for at least 7 seconds in each area. And then you're going to move down to the next section, covering 4 finger widths of your pec major tendon on the sternal head, doing these little micro shears in one area. So you shear and release, shear and release in one area. And I want you just to notice what you're feeling in your body as you are doing this. You might notice already your shoulder starts to want to drop. Bring your fingers down to the next level. If you have a bra and you need to shift your bra out of the way, just pull it down a bit so that you can access the area underneath your bra. You might feel your breathing start to change. And then coming down another level, you're getting down towards the abdominal aponeurosis. So again, if you need to shift to accommodate any undergarments, just move the undergarment around so you can access this area. And if there's some areas which are more tender than others, just take note. And then we're going to move along our abdominal aponeurosis because the pec major attaches in. So we're going to have our fingers still 4, and then we're shearing kind of towards the clavicle, towards the shoulder, getting the tendon organs that are in the aponeurosis of the superior abdomen. Spending at least 7 seconds in each spot. Working your way along. If you have large breast tissue and you have to lift your breasts up and out of the way, just do that. Work with whatever your body has. And then along to the next section. So you should be kind of under the lateral border of your pec major now. And it starts to interdigitate with the obliques. And at this point, we want to come back, heading towards the midline, continuing with these little movements. This is not deep tissue work. It is slow and mindful and gentle. Coming back again towards the midline. Micro shears. Remember the amount of tension in your hands from our exercise on the first day. And then coming to the midline, shifting any undergarments out of the way that you need. And now starting to work your way back up the center. Still just working on the one side. You're not working on the other pec major tendon, just the one side. Up to the midline. And then up again, so that you're coming to the junction between your sternum and your clavicle, giving the mechanoreceptors time to respond, noting any changes in your body, in your chest, in your shoulder, in your breathing. Okay, and then coming to the junction of the clavicle and the sternum, turning your hands so that they're parallel to the clavicle. And now you're going to be doing your movements steering parallel to the clavicle, stimulating the mechanoreceptors here. Moving along. You may not be able to get all 4 fingers on here just because of the hand placement. You may have 3 fingers or 2, depending. And one more time over to where the pec starts to go into the hollow of the clavicle. And at this point, the anterior deltoid starts to take over. This is our last position on the clavicle. And then I want you to turn your arm a little bit into external rotation and then follow the pec major tendon down to where it attaches on your humerus, which is just on the lateral side of the long head of biceps, and down an inch or 2. So you'll feel there's like, you want to feel the border of your tendon on from the inferior side and follow it out. That might be a little bit easier. And your biceps hasn't really started yet. It's this more prominent area. So you want to be working on this area as well. This might be more like 1 finger work, maybe 2 finger work. It's a more tubular tendon here, not so flat. Sometimes because this tendon is more dense, requires a little bit more intervention. So you might want to spend a little bit more time here. Micro movements. You can see this is not going to burn your hand out, but you are going to the epicenter of where the muscle gets its signals, and you're able to create a lot more effect on the whole muscle belly with this minimalist action. This is in the working smarter, not harder category. All right, now coming back to the clavicle, going to the hollow of your clavicle, and then we're going to do the same kind of strokes. You can relax your arm. One more movement back towards the midline. So you're kind of in that midsection. And then right back to where the clavicle meets the sternum. Okay, release your hand and then just feel. Take some breaths, close your eyes so you can really center yourself in your body. What does that pec major feel like as compared to the other side? This is why we're only working on one side, so we have comparatives. What does that one side feel like? I know for myself, it feels quite different. Now I'm going to remove the spotlight on myself, and I want you to go back to your 3 little dots on your tile. Click your 3 dots and pin yourself on your screen so that you can see yourself big on your screen. And then I want you to look at your shoulder positioning now as compared to when you started. Is there a change? Do they sit differently? I know for me, the shoulder I worked on is a lot lower. Before it was more sloped, and now I feel more even. Okay. So put your describing words in the chat now. What does it feel like on that side? Are your shoulders more even? How are they sitting differently? I've got kind of tingles, less heavy, slightly off. Mine tingles too, relaxed, slightly tender, not major difference, maybe warmer. Pec feels bigger, feels more open. Yeah. Even my neck feels less pull on the side I worked on. Very cool. Relief, tender, more relaxed, lighter. I can feel my shoulder being lower on that side. Yeah, so these are great examples. So this is how you can work on this area without burning the body out. You can have this experience of making real change in an area, but not having to dig around. So you're not burning your hands out and you're not overwhelming your patient's body, which may have been surgicalized and can't take a full muscular massage. Leanne says shoulder is more even with the other side. Yeah, for sure. So I want you to now welcome a wonderful woman to this stage. She's in my academy right now, and she's been doing some really wonderful work with us. I'll let her tell her story about how she got into this work. So I'm going to spotlight her to bring her up. This is Kirsten, and she's here to share about her experience with working with breast and chest surgery patients and being in the academy and what that's been like. Take it
Hi,
away.
everyone. Congratulations for making it on day 3. Good work. So my name is Kirsten. I live on Vancouver Island, Canada, in the Comox territory. And I've had a bit of a journey with Erin where in October 2021, she put out sort of a quick post to be like, hey, would anybody be interested in learning breast and chest and oncology massage? And I was one of the people that was like, yeah, me. So when she put together a course on the island where I live, I thought I wanted to get to that course right away. So I took the course with her and it was awesome. It was a weekend course and it definitely stirred something in my mind of curiosity. And it was something that I wanted to include in my practice. And then moving forward from there, I was actually in a car accident later that year and I was unable to work for 2 years. But I actually kept following what Erin was doing and just kind of like the exercise that we just did, you can kind of feel the amount of pressure she was guiding us through. And I thought, you know, if I can get back to work, this is the work that I want to do that's heart-centered and I care about, but also will be much gentler on my body. So as I followed her through her courses, I did more intensive training with her. I did her SCAR course. And then she presented this mentorship was going to happen. And I was like, yes, go for it. Because I'm one of those people, I don't know what it was like when you guys were in school, but I loved a good study group. If I just read from the textbook, I was like, where's it going? And I really need that interaction with other people. And so it's super helpful to know that she was building this mentorship, but I also knew from the kind of person Erin is, how much she values community and collaboration. So just coming into a group where there's that support was key. And it was everything that I was wanting out of the group as well. And we cover a lot of different grounds, from anything from the techniques to troubleshooting to marketing. And it's been really cool to watch the group transform. Like I've seen people be more confident with putting themselves out there and saying like, putting their posts on social media and being really clear about who their ideal client is and talking to those people so that they can be that arm that's reaching out for support. And I had a really neat thing happen a little while ago where, so I went back to work in January and I've slowly been building my practice and being able to work. So I'm not experiencing pain with being back at work. I had to gradually, like I said, work at it. And the community where I'm at, the feedback is great. So I've been seeing quite a few clients with top surgery. And one client reached out to me and just said, like, thank you so much. They were 2 years after their top surgery and had shoulder pain and were unable to rock climb. And so we did one treatment together. And after that, they wrote me and they said that was amazing because the work on the serratus and up into the shoulder, kind of what we just did up into the collarbone and around the pecs, helped to release that shoulder, and they felt more confident to go back to rock climbing. So they were blown away that one treatment did that. And I was so happy that they shared that experience with me. So I'm getting excellent feedback. It's been awesome. It's really like heart-filling work to do. And like I said, our community is very grateful for these services and the word is traveling around. But it's also been great to just been able to go onto like a WhatsApp chat and chat with some of the colleagues that are in the mentorship program and ask them questions, being like, what do you do if this is coming up? And then we meet on a regular basis, and it's been a really, like, we're nearing the end of the 6 months, so it's been really nice to see the familiar faces. So much different than just doing like a weekend workshop, because often you do a weekend workshop and you're like, it was cool, but I have more questions. So this really fulfills that experience. Yeah.
Amazing. I love it. Thank you so much.
Yeah.
I think it would probably be really helpful for people to know what are some challenges that you were experiencing that starting to do this work you've been able to get over.
Okay, yeah. So one of the challenges I had was just sort of that imposter syndrome. I think because I've been a massage therapist since 2008. And when you have that feeling of being already an expert in your field, and then in my case, an injury and then returning, I felt really nervous in a way that I hadn't felt in a long time, because I was like, oh, whoa, I have been doing general massage for almost 15 years and prenatal massage. I know that this is something new, and like, should people come see me? Am I an expert? What does it take to sort of have that confidence? And a lot of that is like my mindset. It was stuff that I had sort of blocking me from going to that place. And Erin really addresses that. But also we talk about it in the group as well. And you start gaining more confidence in yourself because you're given the tools to sort of present yourself and how to present yourself out to the community and how to get your word out. And just when people start coming in, you have the things in place, you have the charts, you have all the details. And we all have to remember, we all went to massage school and there was that very first client that we worked on. So this is kind of bringing that back to when you start at it, even if you've been a massage therapist for a long time, this is something new. You're not going in with brand new hands, but it is something new. And it was just really nice for me to have the support for the one-to-one with Erin, and also the buddy systems that we had. Those were really helpful. Yeah.
Amazing. Great. Thank you. And what about your pain in your hands and your wrist and your ability to work? How's that changed?
Yeah, I think all of it has changed in so many different ways. So as far as like the ability to work, the hands-on is so much lighter, but also there's a mindfulness that is going into the treatment room that I can honestly say it wasn't there before. I always had that intent, but it's even more, and there's lots more of holding space. So you feel really present and holding that space for the person that's there. And it actually feels like so even relaxing to give the treatment. Like I feel better after giving the treatment, even for myself. But yeah, as far as like hands-on, it's very different. I have a torn ligament in my wrist, and it's not causing me any issues at this time. So it's great.
Well, that's so amazing because you didn't
Mm.
think that you were not sure you'd be able to continue to work for a while there. You were like,
Yeah.
am I at the end of my career
Yeah,
here?
I
Or
really wasn't sure. And also I think I am actually amazed at how light the work is. Like even when we do those practice exercises, I can tell that I go a little harder than I need to. And from putting my hands on people, you'll be amazed at how much you are going light, and the person might say, "Whoa, that's really intense." And that was different for me. I was like, "Oh, that's interesting," because I thought that was light. I'll go lighter. So
Mhm.
yeah,
Yeah, I've had that too because some people are really hypersensitive and so they
yeah,
interpret the signals differently and you think you're not doing very much and they're like, "Whoa, that's a 9 out of 10. Like that's
yeah,
painful."
yeah,
And so then
exactly.
you have to back off even more.
Yeah,
Yeah, pretty interesting. Amazing. Okay, thank you so much. I
yeah.
really appreciate
Thanks.
your sharing,
Yeah,
your
of
showing up
course.
for everybody.
Yeah,
Yeah,
yeah.
and
Thanks so
being
much.
present with us.
For sure.
Yeah,
Yeah.
right on. Okay, so now we're going to get into an exercise on mindful versus unmindful touch. This is something that Kirsten spoke about is that her level of mindfulness, she was feeling like a mindful therapist before starting this work, but now she's gone up to another level. And I want you to have the experience of mindful versus unmindful touch. So, yeah, seeing some love for you in the chat there. Thank you. That's so wonderful. I love it. And expressions of gratitude are always appreciated because when you're putting yourself forward, sometimes you're a little bit like, public speaking. I happen to love teaching, so I get all lit up by it. But when I was a child and I public spoke, my face would go red, like the Canadian flag, and my eyes would start to water and they would tear down my face, but I wasn't actually crying. And I had to public speak with these like wet cheeks and shaking hands. And yeah, if you had asked me when I was 10 if I would be in the position I'm at now, I'd be like, no frickin' way. There's no way. Except now I have a mission. I feel like I've been deeded with a purpose. It's like, Erin, you got to get this out here. So get over yourself and get in front of people. So here I am. All right. So we're going to do our mindful versus unmindful touch exercise here. So what I want you to do is I want you to close your eyes, center yourself in your body. Feel your breath a few times coming in and out of your nose. Bring the palms of your hands together and bring them in front of your heart center into prayer pose. Now, I want you to tune in and start to feel your heart beating. See if you can feel the beat of your heart inside your chest. If you can't feel it, that's okay. Just try and tune in. Sometimes when we become mindful, we become aware of what we're not aware of, and that is totally valid. Now, breathing into your heart, I want you to wake up the intention for healing. That feeling of resilience inside of yourself, that love for yourself. And as this starts to wake up in your heart, I want you to feel it expand past the confines of your heart, out into your chest, feeling it growing, this desire for well-being, feeling it expand into your shoulders, down your arms, and into your hands. And as this heart energy comes into your hands, I want you to notice if there's a change in quality in the skin between your palms and between your fingers. Are you noticing more tingling, more warmth? And I want you to allow this intention for healing and well-being to radiate through your hands. So it feels like your hands are getting mitts around them, like it's extending past the confines of your hands. And with this intention for mindful touch, I want you to lay your hands on your chest and follow my guidance as we move our hands around our body, lifting your hands towards your collarbones, over your collarbones towards your shoulders, towards the back of your shoulders, allowing your body to absorb this healing touch, placing your hands over the back of your neck, over the back of your skull, feeling this energy radiating from your heart as you move your hands towards the sides of your head, feeling it coming down your arms and out your hands, moving to the top of your head, feeling your body absorbing this energy, absorbing this intention, coming over your forehead, over your eyes, feeling the sense of care and attention over your cheeks, over your jaw, feeling a sense of acceptance, non-judgmental touch over the front of your neck and back down to your chest, upper chest, and lower chest. Okay, now just taking a moment to feel in your body. What does that feel like in all the areas that you laid your hands? What does your body feel like? What does your mind feel like? And also, what was it like to give, to be on the giving side of it, to hold that intention consciously, to consciously be feeling that radiating energy out from your heart, down into your hands, and into the tissues that you were touching. All right, now shake all that off. Shake, 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 clearing all that mindful touch. Now, I want you to think about an incident that happened recently that you find yourself ruminating on. Maybe there is an interaction you had with somebody that rubbed you the wrong way, and you've been thinking about all the things you wish you'd said to them in the moment. Maybe you're thinking about something coming up ahead that you're excited about, that your mind just keeps going back to again and again and again. Whatever it is, whatever your thing is that's capturing your mind, let it capture your mind. Let your mind go there. And then I want you to put your hands on your body in the same format as what we did before. So starting with your chest, thinking about your thing, moving your hands up towards your upper chest, up towards your clavicle, ruminating on whatever this thing is. That guy who cut you off in traffic is so annoying. Didn't he know that the light was almost red? Moving over the back of your neck, moving over your skull. You know, your partner forgot to take the garbage out again. It's like, we talked about this. You're supposed to be doing this. You're not doing this. Putting your hands over the top of your head, Oh, I'm going to Cuba next month. Oh my gosh, I can't wait. I hear the food is terrific in Cuba. Oh, I got to take my mom to her appointment. Bringing your hands over your eyes, hands over your cheeks. Oh my gosh, my daughter's got her soccer game on Saturday. My son has hockey, and we have to pay the bills. The bank has been calling. How am I going to be able to do this? Bringing your hands to your chest and back down. Now, feeling the difference? What did that feel like to both give and receive? Put your describing words in the chat. First, what it was like to give and receive the mindful touch, and then what it was like with the unmindful touch. What was that like? Tingling, then rushed. Mindful. Why don't I do this more often? Good question. You can moving forward. Sometimes it just takes reminding. Relief. I can breathe better. Yep. Felt delicious. Love it. All over food metaphors. First one felt very calming, and the second one felt like nothing was happening. Very telling. I love it. Unmindful, cold. Second one felt confusing. Good wordage. Mindful touch, calming state, sleepy, non-mindful. I was antsy the entire time. Yes, understandable. It's almost like your body's like, get away. Centered, but very tense tissues. Probably noticed that. That was great. I was annoyed for the second one. Right. Yeah, understandable. Second, I was annoyed as well. Flowing to disconnected. Yes. We should have done the other way around. It's 9 o'clock here. Well, there's a reason that we do it this direction because it makes the contrast more stark. Deeply calm, felt more in touch and self-aware. Different, but I'm too tired to do it properly. No worries. So this is we want you to feel the difference because when you're, most of us as massage therapists, we're like, oh yeah, I'm mindful. Of course, I pay attention. I always think about my patient, but in reality, our mind is actually drifting to all sorts of different things. And sometimes when we're doing repetitive treatment again and again and again, then we take refuge in daydreams and, thinking about other things that are going on in our life because we're just doing the same kind of treatments, same kind of technique, same kind of process over and over again, and we get on automatic pilot. So when you practice mindfully, then you get the experience of coming down into the moment, and it changes it quite dramatically. It can really take an ordinary treatment into the extraordinary. I'm always told in my clinic office how grounded I am and how absolutely not grounded I am everywhere else. Amazing. So it brings out a good side of you. That's great. Okay, so now we're going to move into our own self breast massage. And I want you to practice on the same side that you did your hand meditation on and your GTO release with your mechanoreceptors. Oh, and there was a question earlier about them living in the tendons and the skin. Yes, they do live in both areas. The ones that we are focusing on are in the tendons here. So the process for this is you're going to have no camera on, so everybody's confidentiality is maintained. You're going to, if you're comfortable, disrobe on the top of your body. You'll notice in the video, the woman has a drape on. So if you want to cover the side that's you're not working on with a towel or a sheet or a hoodie or a shirt or something, you're totally welcome to do that. You're going to want some kind of massage lubricant because you're doing Swedish style strokes. And what we're focusing on here is the venous and arterial flow. So if you remember back to our first day when we were doing our anatomy and we were showing you where more of the breast is fed from, the blood vessels feed more of the breast from the medial part. They also come from superior and from lateral, but the inferior portion of the breast is fed more from the medial vessels. So there's a method to our madness. So I'm going to be sharing my screen. You're going to want to be able to see your screen. You're going to want to be able to hear it, but we don't want to see you so that your confidentiality is maintained. All right. You want to have yourself on mute, and you're going to be doing this massage with the same mindful care that we did this exercise with. So before we start the video, we're going to give everybody a moment to get themselves ready. And then we're going to do our mindful grounding into our heart. And then I'm going to play the video. So once you're ready, your video is off, you're unclothed, you're ready to go. Put an R in the chat for ready. And once a whole bunch of R's are in there, then we're going to get started, and we're going to start at the same time. Is that clear? Okay. So everybody can turn their video off. You can disrobe on the upper half of your body if you are comfortable to do so. And you can put a cover over the side that you are not working on and cover up that side. And for those of you who are ready, I want you to be in a very centered state. So close your eyes and breathe in to your heart. Feel yourself breathing into your heart, centering yourself in your intention for well-being, for resilience, for healing, that you can get past hard things and be whole on the other side. And I want you to feel this intention radiating out from your heart, filling your chest, filling your shoulders and down your arms, and into your hands. And just notice if there's a difference in your hands. Now I'm going to take my AirPods out. So I can share the video. And you can do this alongside. It's about a 9-minute video. So you want your massage lubricant. Here we go. Okay, so now thinking about the circulatory system of the body, and you're going to want to clear any kind of static or sluggish venous flow from the area first, because if the blood in the veins is not moving very effectively, it creates a backlog because of all the valves in the veins. And then the arterial flow, which wants to come in and be nice and strong and healthy, it gets backed up because the venous flow is not as effective. And of course, the arteries turn into the veins. So if the area where the blood is going to is not as effective, then it doesn't have a chance for the arterial blood to come in with the same level of accessibility. So more of the fluid releases to the medial side of the breast. And same with the arterial flow, more comes in from the medial side. Now it does come in from superior and lateral as well. It's just there's more vessels that come from the medial side. So when you're thinking about the venous flow, you're going to want to start up near where it's going to be draining, which is coming into this area, like this sort of supraclavicular, infraclavicular, heading in towards this direction. And you're just, to begin with, adding in your oil and then going around the other directions. So that the whole breast then and thorax, anterior shoulder is all covered with oil.
Now you want to have very mindful hands and you're not moving really quickly. You're thinking instead about helping to shift any kind of stagnant blood out of the breast area and following the direction that the fluid is moving. Now along the inferior part of the breast, the blood vessels kind of wrap around. So you want to reverse the direction so that the veins are able to drain out any stagnant fluid. And then move up towards the perforating vessels that happen along the sternum and then up towards the shoulder. Neck. Now, if you want to lift up the arm, help drain the fluid through here. You can do that as well. Okay, so you see my hands are soft. They're not gripping, they're not digging. They're acting as facilitators to sweep the fluid away. So my intention is moving fluid. And then when you're ready to think about the arterial flow, bringing healthy blood back to the area, it starts in the same region, but then you're thinking this time about bringing fresh and healthy blood into the breast, coming from the medial side and then sweeping underneath. You're accessing this whole layer underneath and coming down from superior and then from lateral and getting the whole globe of the breast. And you can just include some scooping. Gentle hands. Pressure is about as if you were testing out a very ripe avocado that you didn't want to squish. You just wanted to test and see how much give it has. That's about the same amount of tissue pressure that I'm using here. There's no blanching in my fingertips or in my knuckles. I have very little tension in my hands. Breast tissue does move. It's very soft. It's not a bone. It's not a muscle. Not a ligament, although there are ligaments in there, but it's all soft tissue. So it may look like more pressure than it is, but it's not overwhelming. Now, if you want to access some of the tissues on the deeper side of the breast, you want to get behind the glandular tissue into the retromammary space. It's easier to do it from lateral and then scooching up and then going underneath and then in to this retromammary space in here. Now, if someone has very large and pendulous breasts, there'll just be a lot more breast tissue that you have to hold out of the way. You can always get your patient to bring her other hand over and just scoop her breast tissue off to the side. That way both your hands are available to do this work. You can also come from the medial side. I'm trying to go into the retro memory space. You just have to be aware these areas can be super tender on people. So you have to be very mindful with how you are approaching this and making sure that you're checking in with your patient about the level of comfort or pain that she's feeling. And a really nice move to sweep away from the breast is you create a teardrop shape with your fingers. And then you put the nipple areolar complex in the center of that. And then you sweep outwards. Sweep outwards. So you compress the breast a bit and then sweep outwards. Now, if you want to get a nice teardrop shape, you can lift the arm up, lift the sheet up, and just pop your knee onto the table and then rest their arm over top of your thigh. So this is the edge of my knee. This is my thigh, my knee, and then her arm is just rested up and over. And that is an easy way for you then to have access. So you can do these teardrop sweeps. Towards the axillary region.
Okay, so when you are ready, come. Turn your camera back on. We're going to have a share circle. So people can share about their experience, what it was like, what are they feeling, anything about mindful versus unmindful touch. If you want to raise your emoji hand, you can do that, and that will allow me to call you up if you want to share that way. Great. This is a safe space. Love to get to know you. How does one side feel compared to the other? The side that you worked on, does it feel different than the other side? Who's feeling brave? Is it weird to say it feels bigger? No, it's not weird to say that actually, because you may have more fluid in there. So it may actually be more like puffed up than it was before. Yeah. Yeah. Someone else felt that too. Yeah. Come on, who's brave? Who wants to put their voice into the circle? My left side feels lighter. Much better. Yeah. Leanne,
Hi.
hear from you.
Yeah.
Yeah.
It's very surprising, I find, how soft it feels and how somehow my hands wants to have more strength in there. And I remind myself all the time, go softer, and it's something I really have to be very aware of.
Yes, I hear you. Yeah. And when we're used to doing, muscular massage with a fairly firm pressure, then you start working on breasts and it's like, whoa, I have to relearn how to use my hands here. I have to relearn my instinct to grip and instead, let things be softer. So thank you for that. Who else wants to share? Kelsey says a lot more relief through the treated side. Yeah, so it feels different, right? Different than the side that had no work on it. Raquel says, same, I kept saying avocados. Yeah, that's a really good marker, or a ripe tomato also a very good marker. If you don't want to squish your ripe tomato, but you just want to feel, you're testing it out. You don't want to squish it and get all the juice all over your hands. You just want to be feeling. That's a good indicator of pressure and strength. Anne, let's hear from you.
Hi. I even feel the side of my neck here because I worked on the left side. I just feel this all lengthened and we didn't even touch that.
Love it.
Yeah, feels very, very warm and tingly and lengthened here.
Love it. Yeah. And it just goes to show how interconnected everything is. Yeah. And when you're working on the breast and chest area, it is amazing how many other areas respond that you wouldn't think. Like people often say, oh, all that back pain that I've been experiencing, I couldn't get on top of it. Now it's gone because you were able to release all the tissues on the front of the body in a way that often isn't done. In the chat here, Shaya says, you look so smooth going around in a circle. If there was no breast there, would it look the same movements? Yeah, a lot of it is the same. You wouldn't necessarily have the circular, like the 3D circle, like the sphere kind of experience because it's a flat chest now, but the blood vessels still travel in a lot of the same ways. Although blood vessels do have to regrow and regenerate because if a breast has been removed, all those tissues that used to feed the underside of the breast and come down over the top, they get pretty significantly altered. So the body has to reform itself, and you want to help that angiogenesis, which thankfully research has shown massage can help with angiogenesis. Yeah. Julie says, this is so fascinating. I know, it's so fascinating. I love it. Andrea, your hand is up.
I recently got like very deep tissue, like myofascial work at the beginning of the week, and I didn't realize how tense I was actually still, like even like from like the deeper work, and then doing like that slow movement seemed to be kind of what my body needed. So it was a really nice difference to experience.
Amazing. Yeah, great to have that contrast. Yeah, and sometimes our bodies are calling out for things that, if we just give it what the traditional system gives it, it just doesn't really answer it. So giving it another option, often it's very appreciative of having another option. Yeah, love it. Raquel asks, how long was that? That was the 9-minute massage. Yeah, 9 minutes. Jocelyn says, I have very rough tissues, but it did feel like I loosened it compared to my other side. Yeah, so that's what, oh, maybe you meant tough instead of rough. I'm not sure. But that's why we do just the one side in these exercises. So you have a good comparison between the one side and the other. Okay, amazing. Well, it's been so fun spending these 3 days with you. I've really enjoyed, I just lost my water. I really enjoyed being able to get to know you inside the class here and also inside the Facebook group. It's been really great hearing about your insights, hearing about your aha moments. And we do want you to do some shares in the Facebook group today. So I'm going to share my screen again so you can see what the share is for today. We want to hear about your key takeaways from today on mindful breast and chest massage. What are some aha moments that you had? What are some sensations that you experienced? Anything that you want to share in the group, we really want to hear about. So that's the first one. And the second one is, what more do you want to learn? Has this whetted your appetite to learn more? If so, what are those things? So that's our share. You want to title it share number 3, just like the other ones, so that we can get to see where you're at. Now, in terms of review, what we covered today, we went over the science of mindfulness. We did a mindful breathwork exercise that you can apply for yourself or your patients. You learned a light touch technique for chest and shoulder that you can apply to anyone, even if you're not working on breast directly. so that you can affect the tone of the muscle without actually reefing on the muscle belly itself. You got an experience with hands-on practice of self breast massage, so you can drift off into your evening with this changed sensation. You participated in a share circle for some community bonding. And then again, I'm just going to reiterate the next step. We have this mentorship and training academy. I would love to welcome you in if you feel like it's a good fit for you. And if you want to talk more, I've got this one-on-one clarity call, so you can get out your handy mobile device and scan this QR code and find a time that suits you. I have some time starting tomorrow and Saturday and next week as well. I would love to be able to talk more about what you want out of your practice and help you create a mini plan to be able to move forward. So that's our experience extravaganza. It's been so nice having you here. Oh yes, we have our group shot for today. Marielle, is your camera working today?
Yeah, I'm good to go today.
You're good to go? Okay. So today we are going to do a special hand movement. This is our MG heart. So yesterday we did our heart like this. And to make it an MG heart, just like on my logo here, you turn it upside down. MG heart. There you go. All right. So we're all going to do our MG heart. Here we go. Marielle, are you ready?
Yeah.
One,
1, 2,
2,
3,
3. Yeah.
go.
Amazing.
Okay, good to go.
Okay, thank you. Well, this has been a slice. I've absolutely loved having you here. Really enjoyed your time, really enjoyed your energy. If there's anything that I can offer you, please let me know. I am here for you. And we will see you in the Facebook group with your shares and hopefully in the clarity call, one-on-one time with me. Yeah, love it. You're welcome, Kelsey. So glad you found that a great course. Karen, glad that the energy is working for you. Raquel, James, Jamie, got my glasses on here. Thea, Jocelyn, Patty, Julianne, Andrea, Letitia, amazing. Oh yeah, definitely present to your boss. It would be so awesome if you got the courses covered. Love it. Beth, good night. Danielle, you're welcome. So nice to see you. Yeah, lovely. Danielle is one of the people I've known longest in my life. Yeah. So lovely. Where can we find the link for the info on the classes? I can drop a link for our upcoming classes. So this is our mentorship and training academy. You can learn more about it. Make sure that I'm sending this to everyone. And it's got tons of information in there. Marielle put a link for some other courses that we're doing as well. I am doing one where it's just the comprehensive training. It's not the whole mentorship, whole shebang. It's just the meat and potatoes, the comprehensive training. It's a 6-day intensive. That's in November. And it's for people who like to get her done. Some people are like, I want time to integrate. I want someone to guide me. I want to have time to implement this and make the change in my practice. And other people are like, I would just want the information. Give me the goods here. So there's a 6-day comprehensive intensive in November, also virtual. And then there's a 2-day science of scar tissue course in person in Vancouver, or sorry, in Victoria, Vancouver Island. So yeah, Leanne says, please come to Montreal to teach. I have been getting some requests to go to Ontario, so maybe I can do a little teaching tour at some point. Yeah, that'll be pretty fun. So if any of you are interested in knowing more, you can always reach out by email. And of course, you can book your clarity call. Beth says, come to Illinois. Maybe I will. If I get enough request from a place, I will go for sure. Yeah. All right, everyone. It's been a slice. Ciao for now.
Thank you.
You're welcome. Bye.